And joining us now, some of the very first healthcare workers to be vaccinated, Dr. Mark Conroy, Dr. Meghana Moodabagil, and emergency medicine nurse Nate Royster, who are on the staff at Ohio State University's Wexner Medical Center. Good morning to all of you. Thank you for being with us.
Morning, Savannah. Thanks for having us.
I'm so happy to see you all. My first question is a good doctor's question. How do you feel? Does your arm hurt? Did you have any side effects from the shot?
I feel great. I slept like a baby last night. It was just the first night of a little bit of relief during this entire pandemic, so I think I felt great.
It was just like getting my flu shot every year. My arm's sore. It'll get better in the next day, and then I'll go back to being my normal self.
My first question was, how do you feel? My second question is, how do you feel? Nate, what does it feel like emotionally to know that you've got the vaccine and that we are at a turning point in this pandemic?
It's definitely a very promising and optimistic feeling. We've definitely been battling this as healthcare workers, as a team, dealing with staffing shortages, dealing with the multitude of patients with high acuities due to the coronavirus. So knowing that there's a vaccine and knowing that we're starting the process of getting everyone vaccinated, especially the healthcare workers that work with the patients every day, it's a very optimistic feeling, and it leaves me very hopeful for the future.
Dr. Conroy, I saw an interview with an ER nurse who said, I'm so tired of worrying. I'm tired of worrying that I might get it, but worse, that I might get my children infected, my husband infected. Is there that sense of relief this morning?
I think it's the first step towards that. Certainly, I've worried about, getting sick and stranding my family or bringing something home and getting my wife sick at the same time. And I think this is the first step towards, ending this pandemic and being able to return to a normal family life.
Dr. Moodabagil, what has it been like for all of you? What has your experience been during this pandemic?
It's been tough. I mean, we work a lot of hours. I just got out of the ICU for the last couple of weeks, and now I'm back in the emergency room, and my colleagues are sometimes getting sick, and people are having to cover shifts for them, and we're seeing and having to have the toughest conversations with families, especially because they can't come visit their loved ones here. It's tough to see that. So this is going to be hopefully kind of the start of the end here.
Nate, we know that the protection from the vaccine doesn't go into effect right away. You need 2 doses. But do you think that you'll have a little different approach as we go through these holidays? Do you feel like you'll feel a little different?
I think I'll definitely feel a little more hopeful. Obviously, there's the sad fact that I can't go see my family for the holidays, but knowing that I'm not bringing the virus home to them and putting any of them at risk, and knowing that we have many future holidays that we can celebrate together is a very good feeling. So just keeping in mind that the vaccine, it's going to be a process, and it's probably going to take a year to reach the amount of vaccinations that we need across the country, but I think it's worth taking a break this year from the holidays and kind of just self-isolating until we can get this virus more under control.
Yeah, that leads me to my next question, Dr. Moodabagil. I mean, we all are elated about this vaccine, and yet there is so much work to be done. What's your message? You're on the front lines every day. What's your message to the public?
I think people are scared about getting the vaccine, and I think, having all of us as providers who take care of our patients kind of step up and be able to take this vaccine now. I hope it gives some confidence to the people who are at home and wondering if this is something that they're going to do. There's data out there, and I kind of want to send the message of do your research, read up on the vaccines, read up on how they studied it, how they tested, and what the results were. And there are a lot of falsehoods that are going to be out there that you just need to you need to learn about, and hopefully that'll get you to get the vaccine.
Well, I so appreciate you guys coming on this morning. I noticed you all got your vaccines together, which looked really fun. Maybe you could do your flu shots next fall all together too. What do you think? Is this going to become a thing?
Start a trend.
Absolutely,
yeah, I think we can make it a thing.
All right, thank you so much. We really appreciate your work on the front lines, and we're happy for you. Keep us posted.